How does CD4 count affect TB, HIV co-infection? Have you ever wondered how CD4 count impacts the relationship between tuberculosis and HIV? Understanding this connection is crucial for managing co-infection effectively. CD4 count measures the number of CD4 plus T cells in the blood, which play a vital role in our immune system. These cells help control both HIV and tuberculosis infections. In individuals who are co-infected with tuberculosis and HIV, a lower CD4 count can lead to several significant issues. First, when CD4 counts drop, the immune response weakens, making individuals more susceptible to tuberculosis. This means that as CD4 counts decline, the risk of developing active tuberculosis from a latent infection increases. In fact, HIV is the strongest known risk factor for activating tuberculosis. Next, lower CD4 counts can change how tuberculosis presents itself. Patients with low CD4 counts are more likely to develop extrapulmonary tuberculosis, which affects areas outside the lungs, and smear-negative pulmonary tuberculosis, which does not show up on standard tests. This can make diagnosis more challenging, as the typical symptoms may not be present. Another important aspect is immune recovery. Tuberculosis infection can actually speed up the progression of HIV by increasing the replication of the virus, which further reduces CD4 counts. After starting antiretroviral therapy, patients co-infected with tuberculosis and HIV often experience slower recovery of CD4 counts, especially during the first 6 months of treatment. This delayed immune restoration can impact long-term health and disease outcomes. The consequences of low CD4 counts and active tuberculosis can be severe. The combination leads to higher rates of mortality and morbidity. Tuberculosis can exacerbate HIV infection by promoting viral replication, which weakens the immune system even more. In practical terms, managing tuberculosis and HIV co-infection requires careful monitoring of CD4 counts. This helps guide diagnosis, treatment initiation, and prognosis. Starting antiretroviral therapy alongside tuberculosis treatment is crucial for improving CD4 recovery and reducing the risk of death. Healthcare providers must also be aware that tuberculosis may present in atypical ways in patients with low CD4 counts, which calls for more sensitive diagnostic methods. In summary, CD4 count plays a critical role in tuberculosis and HIV co-infection. It affects susceptibility to infection, clinical presentation, immune recovery, and overall health outcomes. Maintaining or restoring CD4 counts through effective treatments is essential for managing this co-infection successfully. Always consult healthcare professionals for personalized medical advice and treatment options.